Hello, my name is Adam Winstock and I'm the founder and director of the Global Drug Survey, which runs the biggest drug survey in the world. And I just want to spend the next 5 minutes running you through some of the headline findings that we learned about alcohol use around the world. We had over 100,000 people who took part from over 50 countries. And when we're looking at how different countries compare, it's really important to remember that there are limitations when you can compare different samples. Our samples varied in size, their precise gender breakdown, their average age, and the sorts of people who took part varied across the different countries. So just remember that when looking at some of these comparisons, but I still think there's some really important lessons that we can learn. So in terms of who actually took part in the survey, as we can see, about 85% of our sample were heterosexual, 60% were male, and the average age of our sample was around 30. But just under half of our participants were under the age of 24, and 91% were white. So alcohol obviously kind of varies hugely across Europe and the world, and there's a whole bunch of stereotypes of people who drink wine and spirits and beer. And one of the things that we were really interested in looking at is whether those stereotypes really impacted on the sorts of problems that different cultures were experiencing with alcohol. Last year, one of the really standout findings was just how delusional so many heavy drinkers actually were, with about 1 in 4 people who were at risk of dependence thinking their drinking was average or less than average. For the Irish population, that went up to about 42%. And I guess that's just really worrying, because if you don't think you're at risk, then you just carry on drinking. And certainly in the UK, that sort of explains why so few people with alcohol dependence actually get diagnosed and treated. It's in fact just as little as 6% of people with alcohol dependence. And actually that treatment gap is the biggest of any mental health condition. And that's a real problem, because certainly in the UK, what we're doing is getting a huge increase in mortality rates due to liver. And that's just going to be literally the death of us unless we start changing the way that we drink. So we're going to start off comparing countries, first of all, using the 10-item audit, which is a WHO screening tool. And I'm going to break the scores down both by female and male, but also at levels of problem drinking. So what I want you to look at here is the sort of orangey bar with the number of women drinking at high-risk levels. And you can see that it's highest in Ireland, but also pretty high in the Netherlands, Sweden and the UK, at rates at around 5%. If we look at men, we see a very similar sort of pattern, with the same sorts of countries actually showing really high levels of problematic drinking. Those blue bars actually represent people who are drinking above safe limits. So as you can see, that's pretty much most people. Now, scores of 20 or more on the audit suggest that you may be at risk of dependence. And again, if we look at Ireland, it's really much higher than everywhere else, with around 10% of Irish female participants reporting scores of more than 20. Pretty high in Poland, again, Denmark, the UK. We see the same sort of pattern with the highest rates in Ireland. So one of the things we were interested in is actually what country wanted to drink less. And if countries said that they wanted to drink less, well, actually, were they interested in getting any help? So what you can see is the countries that led the world in actually wanting to drink less were some of the countries with the highest audit scores. So topping the list were pretty much Australia, Poland and Ireland, with almost 40% of our respondents wanting to drink less. And even around the world, it was pretty much 1 in 3. That's a huge proportion. But actually, very few people actually wanted help, with only about 10% of those people, on average, saying they'd like some help. And I guess that we've got to make help really easy, which is why we've developed a free drinking app called the Drinks Meter that you can get on the app stores or at drinksmeter.com, which can give you an idea of just what sort of risk your drinking is placing you at. And it seems to be a pretty good, useful tool. So if you think you're just an average drinker, why don't you get yourself on the drinks meter and check yourself? Now, there's chronic harms from drinking a lot of alcohol. I mean, alcohol is implicated in 60 sorts of chronic diseases, but there's also a really big risk of landing yourself in accident and emergency departments. Now, on average, it was about 1.2% of our sample who had drank alcohol in the last year said they'd sought emergency medical treatment. But what we can see is there were some huge variations, with the highest rates being, again, 2.2% in Ireland. That's more than 1 in 50. The safest place seemed to be those Mediterranean countries, with pretty low levels in countries like Germany as well. Now, I guess the other bit that GDS was really interested in was accepting that people drink alcohol occasionally to sort of shift their mood. And that obviously sits on a spectrum between getting a little bit merry, then probably getting as drunk as you'd want to be, and then getting more drunk than you want to be. So this year, we kind of asked people actually how much they had to drink to get to those different points. So this is women across the world. This is how many 10-gram units do you need to reach that point where you're as happiest as you can be when you're on alcohol, and how much do you have to drink to get past that tipping point. So we can see that the countries where women reported the highest rates of alcohol consumption to get to that happy point were the Netherlands, Ireland and Brazil, where people were drinking, 120 grams of alcohol. So put that in perspective, that's around a bottle and a half of wine. That's a lot. One thing that really stands out, though, is the consistently low rates, or much lower rates, among the Germanic countries. And I'm going to come back to that. Because wherever women lead, men often follow. And we can see a pretty similar pattern of drinking patterns among our male respondents, with countries like New Zealand, Ireland and the Netherlands reporting really high levels of consumption, 150 milligrams of alcohol, to get to that place where they're as happily drunk as they can be. Now remember that WHO guidelines would suggest that you shouldn't be drinking more than 20 or 30 grams of alcohol on any one day. So the fact people are drinking 5 times that to get to that point where they're as happy as they want to be is huge. But the other thing that really stands out to me is the absolute huge margin between the amount that people need to drink to be as happily drunk as they want to be and that tipping point. In fact, it's about 30%. And so what that says to me is that people need to slow down as they approach that place where they feel that they're as intoxicated as they want to be. Because if you don't, what happens is that you end up getting more drunk more often than you want to be. And as you can see in Ireland, it was almost 30% of people saying that they were getting more drunk than they wanted to, at least monthly. And in fact, across the board, it was about 20%. And I just think that there's a way of avoiding that, which is just slow your drinking down. Now, the other thing that was also really interesting is that we wanted to find out what sort of things would change people's drinking behaviour. It was clear that lots of people were running into problems and lots of people wanted to drink less. So we looked at the sort of motivators. And it was different in different countries. So I think one of the really interesting things was that in the Germanic countries, social humiliation or shame was a really significant driver of wanting people to drink less. Obviously, really high levels of concern appropriately over the impact of alcohol on physical and mental health. But it did vary. France, for example, seemed to be far less worried about social embarrassment or humiliation. They were much more worried about violence and being taken advantage of. The Dutch, seeking emergency medical treatment, a huge driver, as well as negative impacts on physical and mental health. But again, social embarrassment, not that much of an issue. And as for the Irish, again, it seems there's a lot of reasons why the Irish would be motivated to drink less. And I guess maybe the lesson here is that it's embracing that motivation into something that's going to nudge people to change. Of course, motivators for change don't just change across cultures, but they also change across genders. And it's very interesting to note that for men, the most significant motivators for change were a negative impact upon their ability to work and study and upon their physical health. So for women, being sexually assaulted was a huge motivator for change, being placed at such extreme risk, but also really high levels of concern over physical health and mental health problems. The other bit that we looked at actually was how likely people were to get served if they were drunk in different countries. And we also wanted to know whether or not people thought it was actually legal to serve you if you were drunk. So what we learn here is that the Brazilians, the Greeks, the Hungarians, the Austrians, they're pretty tolerant, and if you're drunk, the likelihood is you're going to get served. Actually, across the board, it was over 3/4 of people thought that they would be served alcohol if there was someone drunk in their country. The lowest rates were in countries where I know for a fact they've got responsible service of alcohol training for bar staff, and that was in Australia and New Zealand. And in fact, we also see that they're the countries where people had the highest awareness of the fact that it's illegal to serve people with alcohol who are drunk. So I think there's a lot to be learned from Australia and New Zealand and training our bar staff better in identifying intoxication and responding to it. The other side of alcohol, of course, is that there's personal harm that you place yourself at risk at, but certainly getting home at night can be a pretty risky thing. And you can see that some countries were much more dangerous than others in terms of the consequences of other people's drinking. Countries like Ireland and Poland and France and the UK and Brazil having, lots of people, 1 in 3 saying they were, afraid of other people who were drunk in the last year. Pretty high rates of people being assaulted by a person who was drunk, and even fairly high rates of sexual harassment. So I guess it's thinking around that alcohol isn't just a problem for the person using it, it's a problem for the people around them. So what's the 3 take-home lessons? 1, when you get to that place where you're as happily drunk as you want to be, slow down, don't start taking shots, just give yourself a little bit of time to just, enjoy the evening. 2, if you see a friend of yours who's getting way too drunk, step in, look after them. Don't let them go home with someone they don't know or you don't know, because that places that person at all sort of risks. And I guess the third thing is that think about what you want to get from alcohol on a night out, on a week out, and on a month out. And every now and then, actually give yourself a break and actually see how you feel on it. Because the truth is, most of us would probably be a little bit healthier and a little bit happier if we drank just a little bit less. If you're worried about your drinking, or if you think you might have a problem, or if you're worried about someone else you know, then why don't you go to drinksmeter.com, or it's a free app on iTunes or Google Play. Until then, take care.